everybody, and welcome back to Eye Opener. This is Dr. Mridula V Amarnath here. So, have you ever thought if there could be a relation between dry eyes and thyroid? Well, let's find out today. So, dry eyes, basically when your eyes starts feeling gritty, you get a burning sensation, itching sensation, can be related with problems of the thyroid gland. Sometimes it may be the first sign of your thyroid disease. So who is at a risk? So basically there are two types of thyroid disorders. One is Graves' disease. That is where there is an increase in the secretion of your thyroid hormones called as hyperthyroidism. And the other one is Hashimoto's thyroiditis, wherein there is a decrease in the secretion of your thyroid hormones called as hypothyroidism. Now, both of this happens when your immune system, right? When your immune system starts making a mistake and it starts attacking the thyroid gland instead of fighting infections. Now, because certain proteins present in the eye are similar to that of the thyroid tissue, so they also start attacking your eye. Okay. Now, the eye problems, like I said, you have two types, Hashimoto's and Graves' disease. The eye problems are generally more common with Graves' disease, but it can also be seen in those having Hashimoto's. Now, why am I telling you all of this? See, because in case you have dry eyes and you also have a family history of thyroid disorders, then I suggest that you must go and get your thyroid levels evaluated and start with the necessary treatment because it is very, very important. Fine. So now let's find out how our eyes can get affected because of the thyroid disease. So now when the immune system starts attacking the muscles and other ocular tissues, what happens in the eye? Inflammation starts happening, and this can lead to swelling as well as scarring of the eye tissues. So there are many patients who have a mild to moderate Graves' ophthalmopathy will experience spontaneous resolution, maybe, or a spontaneous improvement, I could say, over a period of 2 to 3 years. Or sometimes some individuals will slowly start adapting themselves to the abnormality. But in cases of severe ophthalmopathy, which affects nearly 10% of the patients, what happens is there is a severe form of inflammation that is seen of the muscles. And as a result, there is a lot of swelling that takes place. And moreover, the muscles all start becoming extremely stiff. So now this hampers with the movements of the eye. So I cannot move in all directions properly. So what happens? It can cause a blurring of their vision. It can also, some of them might also have a double vision. Fine. Now in some patients, what happens is this is your eye and there's a lot of swelling that takes place behind the eye. So that results in the protrusion of your eyeball. And because of that, what happens? Your eyelids are not able to close properly because the eye is protruded. So your eyelids are not able to close properly. And as a result, the cornea, that is the black color part of your eye, becomes constantly exposed and becomes more vulnerable. Okay. Now sometimes you also have your eye, you also have an optic nerve here. Okay, so eye and the optic nerve here. So because of the swelling, the optic nerve also gets compromised, and this can lead to a progressive, irreversible vision loss, which is very, very severe and bad. Okay. So the next thing is, we all know that our tears are very important, the tear secretion, because one, they moist the eye surface, they nourish it, and they lubricate our eyes. So like each time we blink, what happens is the tear spreads across the entire surface of your eye and keeps it moist and nourishes them. So, but what happens is when you have a thyroid eye disease, there is not enough production or secretion of tears, and also the tears may not function the way it is supposed to. And this can also drastically affect your eyes. Third thing is we also know that our tears is a combination of water, oil and mucus, right? So the oil is mainly produced by the glands in your eyelid, and this oil helps to hold the water onto the surface of the eye. It basically prevents it from getting evaporated. So what happens is in thyroid disease, there is not enough oil secretion. Okay, and the tears tend to evaporate too quickly, and this can again lead to the dryness of your eye. So let me share with you some tips that will give you a little bit of relief because of your dryness. Okay, so one is try and use an artificial tears or a lubricating eye drops. I would personally suggest that use eye drops throughout the day, while at night shift to an eye ointment to keep your eye moist. Now, in case if you're finding it difficult to close your eyes because of the thyroid disorder, then I would suggest that while you're sleeping, try and use an eye mask so that it helps to retain the moisture of your eye as much as possible. Also, I would suggest that avoid using a ceiling fan because that will only further aggravate the dryness of your eyes. Other things that you could do is one, avoid smoking, avoid sitting too close to an air conditioner or a heater. Now, if possible, in your room or in your workspace or in your bedroom at night, try and use a humidifier. Okay, and if you're someone who's constantly working on the laptop or system, then frequently try taking breaks and frequently make it a point to blink your eyes. In your diet, I would suggest try and inculcate substances that have more amount of omega-3 fatty acids like tuna, sardine, salmon. And if not, then take those omega-3 fatty acid capsules. I'm sure all of these would definitely give you some amount of a relief. So before concluding, let me again stress on the fact that if you have dryness of your eyes and if you have a family history of thyroid disorders, immediately, do not delay, immediately go and get your thyroid levels checked. Because if you do not check your thyroid levels and if it goes way beyond your control, then it will slowly start affecting your eyes and then it becomes really difficult and then you will have to start facing the various complications associated with it. So do not do that. So at the early stage itself, let us try and control the thyroid levels as much as possible. Okay, so think about it and stay safe. Thank you and have a great day. Bye-bye.